The phone rang at 3:17 a.m. on a Tuesday morning. Margaret Thompson, 73, was calling from her bathroom floor, disoriented and shaking. Her blood sugar had spiked to 380, and she could barely think clearly enough to dial my emergency line. Margaret had been fighting type 2 diabetes for 20 long years. 4 different medications, countless doctor visits, and a daily routine that revolved around blood sugar testing, insulin injections, and the constant fear of complications. Her feet had lost feeling from diabetic neuropathy, her kidney function was declining, and her family was preparing for the inevitable progression of this incurable disease. But what happened over the next 90 days would shock her endocrinologist, astound her family, and prove that everything we've been told about diabetes and aging is wrong. I'm Dr. James Whitaker, and I've been a practicing urologist for 25 years. While my specialty is the urinary and reproductive systems, I've witnessed firsthand how diabetes destroys these systems in my senior patients. The erectile dysfunction, bladder problems, kidney damage, and hormone disruption that diabetes causes have made me passionate about understanding the root causes of this epidemic. Margaret's case revealed something that will change how you think about diabetes forever. Her blood sugar problems weren't caused by what she was eating or her genetic predisposition. They were caused by something she was taking every night that her doctor had prescribed 15 years earlier for a completely different problem. The hidden sleep medication diabetes connection. Margaret's diabetes journey began in her early 50s, but her blood sugar problems started when she was 58, exactly 2 years after she began taking Ambien for sleep problems. Her doctor never connected these events because the onset was gradual, and sleep medications aren't supposed to affect blood sugar, but they do in devastating ways that most doctors don't understand. Ambien and other sleep medications work by suppressing your natural sleep architecture. They don't create real restorative sleep. They create drug-induced unconsciousness that looks like sleep but lacks the critical deep sleep phases where your body performs its most important repair work. During natural deep sleep, your body releases growth hormone, which is essential for maintaining insulin sensitivity. Growth hormone helps your muscles absorb glucose efficiently and keeps your liver from overproducing sugar. Without adequate growth hormone release, your body becomes increasingly insulin resistant. But the sleep medication was doing something even worse to Margaret's metabolism. It was disrupting her circadian rhythm so severely that her cortisol levels were inverted, high at night when they should be low, and low in the morning when they should be high. This cortisol chaos was creating a perfect storm of metabolic dysfunction. High nighttime cortisol was triggering massive sugar production by her liver while she slept. Low morning cortisol was leaving her exhausted and craving carbohydrates all day. Her body was essentially creating diabetes from the inside out. For 15 years, Margaret's sleep medication had been slowly, systematically destroying her metabolic health. Each night, the drug prevented the natural hormone cycles that keep blood sugar stable. Each morning, she woke up more insulin resistant than the day before. The most tragic part was that Margaret's diabetes medications were making the problem worse, not better. The more her blood sugar swung wildly due to disrupted sleep hormones, the more medications she needed. The more medications she took, the more side effects she experienced. The more side effects she had, the worse she slept naturally, making her more dependent on the sleep medication that was causing the entire cascade. The 90-day reversal protocol. When Margaret came to me after that 3 a.m. emergency, she was desperate. Her endocrinologist had just increased her insulin dose again and mentioned that kidney dialysis might be in her future. Her quality of life was non-existent, and she was terrified of becoming a burden on her family. I explained to Margaret that her diabetes might not be the permanent, progressive disease she'd been told it was. If we could address the root cause, the sleep medication destroying her natural hormone cycles, her body might remember how to regulate blood sugar normally. Margaret was skeptical but willing to try anything. We developed a comprehensive 90-day plan that addressed every aspect of her disrupted metabolism. Week 1 to 2. Sleep medication withdrawal. This was the most challenging phase. We couldn't stop the Ambien cold turkey without creating dangerous rebound insomnia and anxiety. Instead, we used a gradual, tapering protocol combined with natural sleep support. Margaret began taking magnesium glycinate, which supports natural sleep cycles without disrupting hormone production. She started drinking chamomile tea 90 minutes before bed and implemented blue light blocking glasses after sunset to help her natural melatonin production recover. The first 2 weeks were difficult. Margaret experienced some withdrawal symptoms, anxiety, fragmented sleep, and temporary worsening of her blood sugar numbers. But by day 14, something remarkable happened. She slept for 6 straight hours without any medication, and her fasting blood sugar was 20 points lower than it had been in months. Week 3 to 4. Circadian rhythm reset. Once Margaret was off the sleep medication, we focused on reestablishing her natural biological rhythms. This meant strict light exposure protocols, bright sunlight within 30 minutes of waking, no artificial light after 8 p.m., and consistent sleep-wake times even on weekends. We also implemented strategic meal timing to support her recovering insulin sensitivity. Margaret ate her largest meal at breakfast when cortisol was naturally high and could help process glucose effectively. Her smallest meal was dinner, finished by 6 p.m. to allow her body to enter the fasted state that promotes insulin sensitivity during sleep. By week 4, Margaret's blood sugar patterns had completely changed. Instead of wild swings throughout the day, her levels were becoming stable and predictable. Her morning fasting glucose dropped from an average of 180 milligrams per deciliter to 140 milligrams per deciliter. Week 5 to 8. Metabolic optimization. With her sleep and circadian rhythms recovering, we could focus on repairing the metabolic damage from 20 years of diabetes. This involved specific supplementation with compounds that support insulin sensitivity and glucose metabolism. Chromium picolinate helped her muscle cells respond to insulin more effectively. Alpha-lipoic acid supported her mitochondrial function and glucose uptake. Berberine, a plant compound with powerful anti-diabetic effects, helped her liver regulate glucose production normally. But the most important intervention was strategic exercise timing. Margaret began doing 15 minutes of resistance training immediately after breakfast, when her natural cortisol was highest and could support healthy glucose uptake by her muscles. This simple change had profound effects on her blood sugar stability throughout the day. Week 9 to 12. Medication, tapering, and system integration. As Margaret's natural blood sugar regulation improved, we worked with her endocrinologist to gradually reduce her diabetes medications. This had to be done carefully to avoid dangerous blood sugar swings, but the results were remarkable. Her metformin dose was reduced by half in week 9. Her insulin needs dropped by 60% in week 10. By week 12, she was off insulin entirely and taking only a minimal dose of metformin as a safety measure. The neuropathy in her feet, which she'd been told was permanent nerve damage, began improving in week 8. The tingling and numbness that had plagued her for years gradually resolved as her blood sugar stabilized and inflammation decreased. The shocking results. After 90 days on the protocol, Margaret's transformation was so dramatic that her endocrinologist insisted on repeating all her lab work. He was convinced there had been a mistake. Margaret's HbA1c, a measure of average blood sugar over 3 months, had dropped from 11.2% severe diabetes to 5.7% normal range. Her fasting glucose averaged 95, completely normal for the first time in 20 years. Her kidney function tests returned to normal ranges, and her inflammatory markers were the lowest they'd been in decades. But the numbers only told part of the story. Margaret had lost 28 pounds without trying, simply by fixing her hormone cycles and sleep quality. Her energy levels were higher than they'd been in years. She was sleeping 7 to 8 hours naturally without any medications or sleep aids. Most remarkably, Margaret's relationship with her family improved dramatically. Her daughter told me, "I have my mother back. She's not tired all the time, not worried about her blood sugar, not planning her life around diabetes management. She's present and engaged in ways I hadn't seen since before her diagnosis." The medical establishment's response. Margaret's endocrinologist was initially skeptical of her results. He'd been taught that type 2 diabetes is a progressive, incurable disease that only gets worse with age. The idea that a 73-year-old woman could reverse 20 years of diabetes by changing her sleep patterns challenged everything he'd learned in medical school. But the lab results were undeniable. Margaret's diabetes wasn't just well controlled, it was effectively gone. Her body had remembered how to regulate blood sugar normally once the sleep medication stopped interfering with her natural hormone cycles. This experience led Margaret's endocrinologist to examine his other patients' medication lists more carefully. He discovered that many of his diabetic patients were taking sleep medications, antidepressants, or other drugs that could be interfering with natural hormone production and circadian rhythms. The broader implications. Margaret's case isn't unique. Millions of seniors are taking medications for one condition that are creating or worsening other health problems. The compartmentalized approach of modern medicine, where sleep doctors prescribe sleep medications without considering metabolic effects, and endocrinologists treat diabetes without examining sleep quality, is creating iatrogenic illness on a massive scale. Sleep medications are just one example. Proton pump inhibitors for acid reflux can cause nutrient deficiencies that lead to muscle loss and bone problems. Statins for cholesterol can deplete and cause muscle weakness and cognitive problems. Blood pressure medications can cause electrolyte imbalances that affect heart rhythm and kidney function. Margaret's recovery demonstrates the power of addressing root causes rather than just managing symptoms. When we removed the sleep medication that was disrupting her natural hormone cycles and supported her body's innate ability to regulate blood sugar, her diabetes essentially cured itself. Margaret's new life. 18 months after her 90-day transformation, Margaret is healthier than she's been in decades. She maintains normal blood sugar levels with minimal medication, sleeps naturally without any sleep aids, and has more energy at 74 than she had at 64. She's become an advocate for seniors who are struggling with multiple medications and chronic conditions. I was taking 12 different pills every day and getting sicker, she tells other patients. Now I take 2 pills and feel better than I have in 20 years. Sometimes the cure isn't more medication, it's less. Margaret's story proves that age-related health decline isn't inevitable. When we understand the root causes of chronic disease and address them systematically, the body's remarkable capacity for healing can reverse conditions that were thought to be permanent. Your action steps. If you're a senior dealing with diabetes, sleep problems, or multiple medications, Margaret's story offers hope and a roadmap. 1. Examine your sleep. Are you taking sleep medications that could be disrupting your natural hormone cycles? Work with your doctor to explore natural sleep alternatives. 2. Review all medications. Look for drug interactions and side effects that could be creating new health problems while treating existing ones. 3. Support your circadian rhythm. Consistent sleep, chalk wake times, morning sunlight, and evening light restriction can restore natural hormone balance. Time your meals. Eating your largest meal when cortisol is naturally high, morning, can improve insulin sensitivity significantly. Track your progress. Monitor not just symptoms but also sleep quality, energy levels, and overall well-being as you make changes. Margaret's transformation didn't happen overnight, but it did happen. At 73, she proved that it's never too late to reclaim your health and reverse conditions that were supposedly permanent. Her diabetes reversal wasn't a miracle. It was the result of understanding and correcting the root cause of her metabolic dysfunction.